Come to our topic today, uh, students and lecturers. Welcome to our topic. Today we'll look about the upper limb fracture, basically on chest fracture. So chest fracture is a break or crack in the bone enclosing the chest. We know there is a cavity here called chest thoracic cavity, which is very important in protecting the vital organs such as lungs, even heart. You know the heart is to pump blood. So we are going to classify types of chest injury. There is rib fracture, there is scapular fracture, and there is clavicle fracture. So clavicle fracture. So we start with first one, limb fracture. So limb fracture is one of the most common type of fracture caused by trauma, fairing, primary bone tumor, osteoporosis, softening of the bone, weak through. We have blunt force injury. These are the most common cause of hip fracture. So limb fracture, just a break in the limb bone or thoracic skeleton. So let's now go to this is the clinical presentation or the diagram uh, which shows the fracture in the transverse way, which is vertically. So it's a fracture showing the vital organs, such as there is lungs, there is even there the heart is, and there is a sternum there. So this is the clinical picture. Okay, so now we look at second classification of rib fracture, which is clavicular. In other way, you can call it collarbone fracture. So it's the breakdown in the collarbone. So it is caused by direct blow to the shoulder, or during a fall onto the shoulder, or even likely accident like car collision and fall onto outstretched arm. So we can see the x-ray here showing clinical features of the fracture, which is type of fracture communicated here. We can see it. So this is fracture. So let's go to scapular fracture. You know, scapular is protect of the shoulder. It's one of the shoulder's protection. So it's the fracture of the scapula of the shoulder blade caused by trauma involving the large amount of force. So the force causes scapular fracture. So we have got general manifestation and representation of the chest. So they are grouped into two. There is respiratory and cardiovascular. When you say cardiovascular, it's something to do with the heart and their basis vital organs. So we have got signs and symptoms. So signs and symptoms of cardiovascular. There is rapid fresh pulse. There will be decreased BP, blood pressure. There will be narrowed pulse pressure. There will be also arithmetic BP value in arm. There will be distended neck vein. There will be muffled heart sound. These are the signs and symptoms of cardiovascular. So we'll come now to respiratory. So respiratory has to do with breathing. So we have got dyspnea. So another symptom will be dyspnea. difficult in breathing. There will be cough with or without hemoptysis. Hemoptysis. So we means coughing out blood. Coughing out blood. There will be difficult in air passage. We know trachea. It's air in the air also. So trachea will be deviated. So be audible airings escaping of air from the chest. You can feel it, you can hear it. There will be decreased breath sound on the side of injured. There will be also decreased in oxygen saturation. There will be fourth saturation. These are the respiratory manifestation and signs and symptoms of the chest. So now we go to local clinical presentation. So local clinical presentation will be pain, swelling, bruising. So there will be pain, swelling, bruising, cracking. There will be also, so there will be pain, there will be pain, there will be swelling, there will be browsing, there will be crimping. So these are the clinical manifestation. The bulging and the deformity of over the bone. There will be inflammation. There will be abrasion or opening chest wound. So there will be opening chest wound. So now we know how can we diagnose this. First, we believe that 90-80% is done with history taking. As when a client visiting your health facility, first of all you have to ask history, demographic key, past medical history, everything you ask to find out, to make sure to reach at a proper diagnosis. We have got chest x-ray. You know, x-ray is very, very important to see the inner of vital organs, to see the fluid, their accumulation of fluid, their bone, their any fracture like this. You can see computer tomography with CT scan and ultrasounds. So now we come to complications. So complication, there is pericardial tamponade. There will be airway obstruction. There will be pneumothorax and hemothorax, fried chest, pulmonary infusion. So comes to management. First of all, you do airway and breathing and circulation, which is ABCD. Disposition, put the bone in order. If you find that the patient has got more or 3 fractures, you admit. Elderly patient with 60 years of chest fracture admitted to ICU. You can give analgesics. So analgesics, these are drugs in pharmacology that are able to relieve or to abolish pain or sensation. Local anesthesia, you can do local anesthesia. You can give narcotics. You can give narcotics and pulmonary tolerance. These are the management. Thank you for this tutorial. May you share and subscribe to our channel. God bless you.